so this question is about painful pimples during periods. Why does it happen, and is it possible to get rid of them? This includes the pimples in the genital area.
Okay. So the pimples occur because of hormone fluctuations, especially the ones on the face, but it can also occur in the genital area. Ways to prevent them is to exfoliate sometimes, like the normal beauty things that we do, use a scrub and try to open up your pores, moisturize your face all the time so that it's not dry, it's not oily, so your pores won't get clogged up and then it won't get infected. The same thing also for the genital area. Change your pads often, 4 to 6 hours usually, so that the genital area is not moist all the time, so that it cannot breed infections, and then the hair follicles will become infected and then it becomes very painful. So those are the ways that you can help prevent acne in menstruation.
Wow. Okay. So guys, remember the scrubs and all those creams you're using, they're very important.
Very important.
Okay, so I think this would have to do with motherhood. It revolves around there. How long after one gives birth do they start menstruating, and how long does the post-birth menstrual flow take?
Okay. So for after birth, usually your period will come back if you are not breastfeeding. So the key factor there is breastfeeding. When you are a breastfeeding mother, you produce hormones that prevent your menstruation from coming. So when you do not breastfeed at all, your menstruation can come back as early as in the next 1 month or 2 months. But if you are breastfeeding, your period can go away for probably a year, sometimes 1 year, 6 months. So that's the key. If you are a breastfeeding mother, the tendency of you receiving your period will be very low. But it does happen sometimes, so that's not abnormal also. Some women have different hormones level in their body, so even when they are breastfeeding, they still see their menstruation, and that's also normal.
Okay.
That's why we also encourage mothers to breastfeed, because we say it's a form of contraceptive, so that you do not give birth immediately after giving birth to a baby. You do not get pregnant, because once you are breastfeeding, there is no menstruation, there is no ovulation, then there is no pregnancy.
Yeah.
Yeah. So usually about 1 year once you are breastfeeding. But if you are not, it can be as early as 1 or 2 months.
Okay. So how long would you say the post-birth menstrual flow takes?
It should be regular as your normal menstrual flow. So maybe the first 1 or 2 months, it might not be as it used to be before. So say you were having your menstrual flow for 3 days. The first 1 or 2 months, it might come for only 1 day or 2 days. But then it should regularize to what it was before.
Okay. Okay, from like what I understand from this question, I think they're asking mostly about like once you give birth, there's just like
the bleeding.
the blood,
Okay.
the bleeding.
All right. It should take about 1 week, 1 to 2 weeks to go away completely. Okay. So it will change color gradually. The first 3 to 5 days, it may still be red blood, and then it will become pink, and then it becomes like white with just a tinge of blood in the end, and then it goes away.
Okay.
Yeah.
Wow.
It's called lochia.
Okay. It's called, I'm sorry?
Lochia.
Lochia. Okay,
Yeah, so lochia rubia. They get the red, the pink, and the white.
Okay, that's okay. Women, we have a lot to deal with.
Not to know and learn. Yeah.